The United States spends roughly $4.5 trillion per year on healthcare. That's more per person than any nation on Earth. About $13,000 for every man, woman, and child. And despite all that spending, Americans live shorter lives than citizens of 46 other countries. You are paying more money for worse results, and the reasons why will make you furious. Let's put $4.5 trillion in perspective. That's more than the entire GDP of Germany, more than the entire GDP of the United Kingdom. America spends it every single year just on healthcare. Per person, that's roughly $13,000 per year. Compare that to other wealthy nations. Switzerland spends about $8,000, Germany about $7,500, Canada about $6,000, the UK about $5,100, Japan about $4,800. America spends nearly double what the next highest country spends and almost triple what Japan spends. So what does America get for spending 2 to 3 times more than everyone else? Lower life expectancy than 46 countries. The US average is 77.5 years. Japan is 84. Switzerland is 83. Australia, Spain, Italy, and South Korea all exceed 82. Even Chile and Costa Rica, countries with a fraction of America's wealth, have higher life expectancy. American infant mortality is higher than 33 other OECD nations. Maternal mortality is the worst in the developed world and has been rising, not falling. Here's why it costs so much. The same MRI scan that costs $1,100 in America costs $350 in France and $280 in Australia. The same hip replacement that costs $40,000 in America costs $12,000 in the Netherlands. The drug Humira costs $7,800 per year in America and $1,400 in the UK. These aren't different procedures. Same scan, same surgery, same drug, different price. America is the only wealthy nation that allows hospitals and drug companies to set their own prices with essentially no government negotiation. About 27 million Americans have zero health insurance. Another 40 million are underinsured, meaning they have insurance but can't afford to actually use it because of high deductibles and copays. That's 67 million people who effectively don't have real coverage. Medical debt is the #1 cause of personal bankruptcy in America. Over 100 million Americans carry some form of medical debt. No other wealthy nation has this problem. Not one. In the UK, France, Germany, Japan, Canada, Australia, and South Korea, medical bankruptcy does not exist as a concept. An ambulance ride in America averages between $1,200 and $2,500. In Germany it's free. In France it's free. In the UK it's free. A 3-day hospital stay in America averages $30,000. In Spain it's free. A broken arm in an American emergency room costs between $2,500 and $7,500 depending on severity. In most of Europe you walk out without a bill. Americans aren't getting 3 times better care. They're getting similar or worse care at 3 times the price. Sources for this video include the World Health Organization, the OECD, the Centers for Medicare and Medicaid Services, and the Commonwealth Fund. I want to know from you, have you ever avoided going to the doctor because of cost? Have you ever gotten a medical bill that shocked you? Drop your story in the comments, because I think we need to see the real human cost of these numbers, not just the statistics.